Okay, today we're going to talk about the membranes of the body, and there's the cutaneous membrane, which is your skin, okay, the outer covering, your outer membrane, mucous membrane, serous membrane, and then this little M with a circle around it, that's my symbol when I'm writing, like that's my little abbreviation for membrane when I am taking notes. So we have, in this slide, we have the cutaneous membrane, and then we have the mucous membrane, which is in this diagram, and the serous membranes that are in pink. So serous membranes secrete serous fluid, which is a clear water-like fluid. And the serous membranes themselves are clear and shiny, thin membranes. And we have these membranes around the heart, which this is at the heart. That symbol for me also means around the heart, which is called the pericardium. Around the lungs, which is the pleura, and around your guts, the serous membrane around your guts is the peritoneum. I introduced you to the peritoneum in a previous video. So we have this membrane surrounding the heart, the lungs, and all of your guts. And there are two layers. Each serous membrane has two layers. You have the visceral layer, which is attached to the organ. Visceral means internal organ. I mean your viscera, like deep in my viscera. I can feel it in my viscera. That's like deep down in all of your internal organs. And so the membrane, the serous membrane is attached to the organ is the visceral membrane. And then the membrane that is not attached to the organ is the parietal membrane. And between them, there's a space housing the serous fluid, which is the water-like fluid. And so these organs, the heart, the lungs, and your guts, are inside, they are sitting inside this kind of like sack of water, like completely surrounding the heart. The pericardium is a space that holds the serous fluid, which is a water-like fluid. So it is as if the heart was inside a sack of water. And so sometimes the pericardium, it's also known as pericardial sac. The pericardial sac, because it's like a sack of water completely surrounding the heart. And so this little diagram of the fist in a water balloon, it's very much like that. Now the purpose of the serous membrane is to create a friction-free environment, so that when the heart is beating, it's not rubbing up against something and rubbing raw. It's not like injuring the tissue of the heart. Same with the lungs. When your lungs are inflating and deflating and inflating and deflating, in motion, moving, it's just moving in a friction-free environment. It's not rubbing up against your abdominal cavity, some tissue, rubbing up against it. And because if it were constantly rubbing up against something, it would wear down and wear out. So it creates, the serous membrane's purpose, its function, it's very important, is to create the friction-free environment so they can move without getting injury. So it is for protection by protecting the organs from mechanical injury, like every time that they move and they're not getting injured due to friction. Now, the specific tissue type that makes up the serous membrane, this I'm introducing you to tissue type, okay, because we're going to elaborate on this more. So the more times that you're introduced to tissue, the better. Okay, so this is our first introduction to what is specific tissue type. Well, the serous membranes are made of simple squamous epithelium. And what does that mean? Simple means just one layer of cells. You just have one layer of cells. And squamous, the type of cell, it is a flat scale-like cell. So squamous means flat, scale-like. So this is the type of tissue. This is kind of what it looks like. Just one layer of cells, this flat scale-like cell. So it's a very thin layer of this tissue that makes up the serous membrane. So this would be the tissue that makes up the visceral layer of the serous membrane and the parietal layer are both simple squamous epithelium. Now, they are also known as mesothelium. So the simple squamous epithelium that makes up your serous membrane is referred to as your mesothelium. The mesothelium. You'll say the mesothelium. What is the mesothelium? Mesothelium is the simple squamous epithelium that makes up your serous membranes. That's the tissue of the visceral and parietal pericardium, the visceral and parietal pleura, the visceral and parietal peritoneum. That's the specific tissue. And the reason is because this tissue was derived from the mesoderm. And since it was derived from the mesoderm, that's how it got the name mesothelium. But if somebody says to me mesothelium, I know they're talking about the serous membranes. So they're talking about the serous membranes, a specific tissue type that is the serous membrane around the heart, around the lungs, and around the guts. Now, I know you have heard of these commercials on television. They're always advertising and looking for mesothelioma, like patients or individuals that have mesothelioma, and this like a law firm that wants to like, I guess, fight for those particular patients, even though mesothelioma is very rare. But what is it? Well, the oma right here, that is it means tumor, of the mesothelium. So mesothelioma, they're going to have a tumor or multiple tumors within the mesothelium. And so that serous membrane around the heart could have a tumor. So the pericardium might have a tumor within it. Or the pleura. Most likely, most of the time it is the pleura that has the tumor, or it could be within the peritoneum. So that would be constant repetitive injury to the organ because it's rubbing up against this tumor. You no longer have that friction-free environment that it's supposed to have, and you get this tumor that's just a big clump of cells that's kind of like sitting on the organ, and every time the organ moves, which all of those organs move constantly, it would have friction, and that could lead to injury to the organ. So it's kind of a terrible cancer to have. They are usually malignant, which means they're the kind that metastasize. They're the kind that spread and goes from the mesothelium to some other, or maybe to the organ itself, to the lungs. And now it's cancer of lung cancer because it spreads. And the prognosis is poor. It's like usually they die within a year, so it's kind of terrible. Okay, the peritoneum. So the peritoneum, that we already know, is the serous membrane around your guts. And you have the visceral peritoneum that is attached to the organ, like the stomach, which is constantly moving, small intestine, large intestine. And you have a parietal peritoneum that is not attached to the organ. And so in between the visceral and the parietal layer, you have this space that's full of serous fluid. So the organ can be having this long rolling contractions and be moving without getting injured. So it's just kind of surrounded like in a sack of water, like in a water balloon. Now it is possible that the peritoneum could get infected. If that were to happen, it's called peritonitis. Peritonitis is inflammation of the peritoneum. So an inflamed peritoneum. That would be painful. It would be like all in your abdominal region. If that's inflamed, let's see. Okay, so the peritoneum. Now, if it is not inside the peritoneum, like the stomach is within the peritoneum, like the peritoneum surrounds the stomach, small intestines, large intestines. If it's not inside these organs, then that is referred to as retroperitoneal. So right here it says retroperitoneal. These are organs like the urinary bladder, the kidney. Those are outside of the peritoneum, and that's because those organs do not move. Well, the urinary bladder does, but those organs don't move. The kidney does not like have constant peristalsis, and so it does not need to have that type of protection. So that's going to be, the word is written right here, retroperitoneal. I'm going to have it on another slide referring to retroperitoneal. Mesentery. Okay, mesentery is a double fold of peritoneum. So the peritoneum is two layers. It has the visceral layer that is attached, and it has the parietal layer that is not attached, right? So it's two layers. But the mesentery is a double fold of peritoneum. So how many layers is the mesentery? Since I'm telling you it is a double fold of peritoneum. How many layers is it? So you should have said 4 layers, because you've got the visceral and the parietal of one and the visceral parietal of the other. So it's a double layer. So it's pretty thick because it's got 4 layers of membrane. And this is the mesentery right here. Now the purpose of the mesentery differs. It has a different function than the peritoneum. Peritoneum provides friction-free environment. So guts can be moving food down your digestive tract. But the mesentery, which is this thick membrane right here, it kind of like holds your guts in place. It's like this thick structure that holds your guts in place. This is the large intestines. This is the small intestines. All of this is small intestines, the appendix. So this right here is my model of it's Tommy's intestines, and this is the mesentery. And not only does it kind of like help hold these structures in place and give it like structure, give some structure to those organs and hold them in place, but it also serves as a location for these arteries. The arteries run within the mesentery. You have artery, vein, and nerve. So it supplies like almost like a skeleton. It provides supportive structure and holds everything in place, and it also gives support to arteries, veins, and nerves. So mesentery is super important. This is Anna's intestines here. We're looking at like the backs, the posterior side of her intestines, and this vein artery is her superior mesenteric artery, and here's her inferior mesenteric artery. So they are within the mesentery. So all this white membrane that's kind of holding the guts together is referred to as your mesentery. So the mesentery. Now, you can take a scalpel and you can cut it, but it's pretty thick. I'm telling you, it's a tough structure. It's very supportive. Now, before I teach you about the greater and lesser omentum, let me teach you two little structures about the stomach. So here we have the stomach, and it has this greater curvature here and lesser curvature here. So this is the greater curvature of the stomach, lesser curvature of the stomach. So this is where we get the names for the greater and lesser omentum. So the greater omentum travels from this greater curvature of the stomach, which is here, the greater curvature of the stomach, down, back up to the transverse colon. So it makes this pocket. Okay, let me go back and tell you what is the greater omentum. The omentum, okay, the greater and lesser omentum. They are a double fold of mesentery. How many layers is that going to be? The mesentery is a double fold of peritoneum, and we had determined that the mesentery was 4 layers. Now we have a double fold of mesentery. You have the mesentery and then another layer of mesentery. It's double layer of mesentery. So how many layers of serous membrane is the omentum? So you should have come up with 8 layers. So talk about being very, very thick. So this structure is going to be ultra thick, okay, double strong, stronger than the mesentery, okay, double the strength. And the greater omentum is traveling from this greater curvature of the stomach down and then back up to the transverse colon. And so it actually creates a pocket. It creates like a purse. And inside the greater omentum, what you have is some fat there, some adipose tissue, some nice fat, like a nice cushion, and you have insulation, and that is protecting your guts, because you notice that you do not have skeleton protecting your guts. You don't have like your rib cage, you don't have any bones protecting this abdominal organs, okay? So it's nice to have this greater omentum that is full of fat, that if you were to get like a blow to your abdomen, there's like a little layer of cushion there, which is the fat. It also helps keep the organs warm. Now the lesser omentum travels from the lesser curvature of the stomach to the liver. So underneath this liver here, there's going to be the lesser curvature of the stomach, and then a double fold of mesentery, omentum, that's going to the liver. Now, what is the purpose? It does not have a pocket. It's not full of fat. But the purpose of that lesser omentum is to keep the liver on the right and keep your stomach on the left. Okay, stomach's here and the liver is here. So, stomach, liver, okay? And it just helps keep those in place. I had told you that I was going to show you a slide of retroperitoneal. So all of these structures here are outside of the peritoneum. They're not inside the peritoneum. So they're not surrounded by peritoneum. There's no serous membrane around these organs. So it's going to be the kidneys, the adrenal glands, the spleen. These don't move. And the urinary bladder. back to this what we have here is going from that. This is the liver, and this is the stomach. So between the stomach and the liver, that's going to be the lesser omentum. That is holding the stomach and the liver in their correct location, just holding them in place. And you would need to have this mesentery and omentum to hold these structures in place because of that intra-abdominal pressure that builds up every time you sneeze, cough, or go to the restroom. Okay, when you're micturating or defecating or coughing or sneezing or vomiting, there's this pressure that builds up within the abdomen, intra-abdominal pressure. And it can push your organs like out of place. It can push on the small intestines, large intestines, and it can push them out of place. So we need those mesentery omentum to help keep the structures in their correct location, so they're not just moving all around every time you cough, every time you sneeze. You have a blowout. You have intestines going all over the place inside your abdominal cavity. So you need something to hold it in place, and that would be the mesentery and the lesser omentum holding the stomach and liver in place, while the greater omentum isn't necessarily holding organs in place, but it's just got that nice pocket of fat that's protecting your organs from blows to the stomach, to your abdominal cavity, and it keeps them warm. It's a cushion. So this right here is that pocket I'm talking about. So the greater omentum, it's going from the greater curvature stomach down, back up to this transverse colon, and it creates that pocket. And inside this little purse here is adipose tissue or fat. Okay, so this slide, I wanted to ask you, what is the name of the structure X, and give the name of the structure Z. Okay, so now the mucous membranes. Mucous membranes are thicker than serous membranes, and they secrete mucus. Instead of serous fluid, they secrete mucus. Mucus is thick and viscous. Viscous, it's like syrup. It's like thick. It's much thicker than water. Viscous, when you're talking about viscosity, you're talking about like how sticky and how thick it is. And so mucus is much more viscous than serous fluid. And the mucous membranes are going to be where you have all openings to the body. So lining all openings of the body. So there's a mucous membrane lining your nasal cavity, lining your oral cavity, your buccal cavity, like inside lining the cheeks. You have mucous membrane everywhere that you would have an opening to the body. And this is again for protection. It's also lining the alimentary canal. The alimentary canal is the passageway that goes from the mouth all the way to the anus. So that's what it means, alimentary canal. That is your passageway that goes all the way from the mouth to the anus. And so we also have mucous membrane lining your respiratory tract, in the lining of your lungs. Now, the type of tissue, the specific tissue type that makes up the mucous membrane differs depending on its location. So it depends on the location. if it is lining all the openings of the body, okay, if it's lining your nasal cavity, if it's lining the oral cavity, so you're covering your tongue, lining your cheek. Also in the eye, we have this structure called the conjunctiva, which I want to add that. Okay, so the conjunctiva, which it's covering your eye, and it also lines the eyelids. So like if you were to flip your eyelid, you know, it's lining on the underside of your superior and inferior eyelid or palpebra. The cornea is not a mucous membrane, but it is also stratified squamous epithelium. So stratified squamous. So what this means, stratified squamous, it means layers. So remember, it was simple squamous was your serous membrane. Stratified, simple means one layer. Stratified means many layers, many layers. And squamous, it's still a flat scale-like type of cell, like scale-like, like for protection. So if it's an opening to the body, it really does need to be for protection. And that top layer of cells, these are scale-like, and they're also dead cells. So if they were to get burned or scratched up and scraped up, well, it's okay because they're dead cells. So it's almost like you have like a callus on the top because these are dead cells on the very top. And the new cells down here push the old cells up. So by the time it reaches the top, you have, by the time it reaches this top part up here, they're dead cells. Okay, so where else do you have this? It's gonna be, like I'm saying, like your eye is gonna need to be protected. The nasal cavity, the buccal cavity, which lines your cheeks, the oral cavity, so covering your tongue. Also, it's going to include the pharynx. The pharynx, which is commonly referred to as your throat. It's a 5-inch passageway behind the nose, the mouth, and the larynx. This is referred to as your throat. And the esophagus, which carries the food down to the stomach. So all of these structures are going to be stratified squamous epithelium for protection, because you are swallowing like scorching hot coffee and burning up your esophagus, and you're eating Doritos, but you're just so hungry you're not chewing them, and they're scratching, you swallow them and they're scratching up your esophagus. Okay. And then you have the sword swallowers, right? Catch the sword on fire and then they swallow it and they have it go down their esophagus. That's because the esophagus is stratified squamous epithelium, so it is actually protected. The top layer cells are dead. Where else? What else is considered an opening to the body? So the vagina is going to be a mucous membrane that is stratified squamous epithelium for protection. The rectum, which is the very last part of the large intestines. So in that alimentary canal, goes from mouth to anus. The mouth is stratified squamous because it's an opening. The mouth, the pharynx, and the esophagus. And the rectum, which is an opening at the anus, that little area there is also stratified squamous for protection. The last part of the urethra, so when the urine exits, that very last part, the opening of the body, is stratified squamous epithelium. Now in the GI tract, it is a different tissue. So GI, that stands for gastrointestinal. So that's the stomach, small intestines, large intestines. The stomach, small and large intestines. GI, gastrointestinal tract. It is a different kind of tissue, okay? It's going to be simple columnar epithelium. Simple meaning one layer of cells, just one layer of cells. Columnar are column-shaped cells. They're not the squamous scale-like cells. They're column-shaped cells. And occasionally you'll have a goblet cell. So the goblet cells are these cells here that fill with mucin, and that's just kind of secreted to the surface and mixes with water and becomes mucus. And this is going to line the entire GI tract, and that is best for absorption rather than protection. It is for protection. It is a mucous membrane, so it is protecting you. You're secreting mucus, which the mucus traps bacteria, it suffocates them, it traps viruses, harmful agents, and it's lining your, everything is secreting the mucus, and that lubricates and keeps everything moist and prevents desiccation. So the purpose of the mucous membranes, which kind of skipped, but the purpose of the mucous membranes is to protect, again, okay, from injury. And one of the things is protecting from injury is desiccation. So if any of these structures were to dry out, that would cause injury to the organ, because it would cause like a crack, and then it would be a place where organisms would be able to invade into the organism. So it keeps everything lubricated, wet, moist, prevents desiccation, which is to dry out. Also, it traps bacteria and viruses and suffocates them. So it helps prevent foreign invasion, infections. And mucus also has in it immunoglobulin A, which is an antibody that attacks and kills microorganisms. And it has lysozyme, which also helps digest microorganisms. So the mucus itself helps prevent invasion, infection, and it just keeps everything wet and moist. Now, if you're lining the respiratory tract that I'm talking about, it's from the larynx. So it's going to be the larynx, which is your voice box, the trachea, which we commonly refer to as our windpipe, the bronchi, right and left bronchus, primary bronchioles, secondary bronchioles, tertiary bronchioles, terminal bronchioles. So all of that part of the respiratory tract, which is known as the conduction zone, that's just carrying air down to the tiny little alveoli where you can have gas exchange. So on its way, it has to travel through all of these passageways from the larynx, the trachea, right and left bronchus, primary bronchial, secondary bronchial, tertiary bronchial, terminal bronchial, before it gets down to where you actually have gas exchange. So the entire, well, I call it the upper respiratory tract, but it may be more correct to refer to it as the conduction zone. This entire conduction zone is lined with pseudostratified ciliated columnar epithelium. Pseudostratified means that it looks like it is in layers, but really and truly it's just one layer of cells. So it looks like there's a layer and there's another layer of cells, so it looks like it's stratified, but there's really just one layer of cells. It's how they are arranged. Ciliated, these cells actually have cilia on their surface, the cilia. And columnar, because they're long, they're column-shaped cells. They're not squamous. They're column-shaped cells. So pseudostratified ciliated columnar epithelium is what lines our upper respiratory tract, this conduction zone. And it has goblet cells as well. So every once in a while you'll run across a goblet cell that's secreting mucin. Now, again, the mucus is there to trap bacteria and foreign substances that are in the air that you're breathing. So it's cleaning the air that you're breathing. So by the time it gets down to the alveoli, there should not be, hopefully, very minimum amounts of bacteria present. And you have fungal spores, viruses in the air, and this is supposed to be trapped and removed from the air by the mucous membrane, this lining the pseudostratified ciliated columnar. And the cilia, those are moving. They all beat like synchronized moving. They're all beating together. They're moving together. And they beat quickly. They are beating 9 times a second. That is very fast. And they are creating, and they're synchronized, all going the exact same direction, this 9 times a minute. 9 times a second. 9 times a second. And they are creating like an undulating wave. They're creating this wave movement that causes the mucus that's being secreted in the lungs to move up, all the way to the larynx and then down the esophagus. So that mucus that you are secreting in your lungs to trap foreign substances that are in the air, that is trapping those foreign substances, it gets removed from the lungs by the cilia. So the cilia move them up and then down the esophagus, and it works its way out. And you are making new mucus all the time to replace the old mucus. But if you smoke a cigarette, it paralyzes the cilia for an entire hour. So what happens is the mucus that's supposed to be getting up and moving out, it doesn't move out. It's because the cilia are paralyzed and they're not moving that mucus up and out. So the mucus stays in the lungs and with all that dirt, the bacteria, the viruses. And this is why if you smoke, you have a much higher chance of getting upper respiratory tract infections, respiratory infections, respiratory diseases, because the mucus is going to stay down there, and it's bad mucus. It's got like nasty stuff in it. And so this over time, smoking over time would turn those lungs, actually they turn black because they're dirty. They have all that dirt inside the mucus, and the mucus can't get out. And so one thing that smokers have is this like hacking cough. Smokers cough, and when they're not smoking in the night, the lungs are trying to get out that nasty, dirty black mucus, and so the cilia start to try to work again, and to help them, they have that hacking cough in the night, like trying to get up and out all that dirty mucus to help get it out of the lungs. Now, if you stop smoking, your lungs are black. You've been a smoker for years, but if you stop smoking and you didn't do any permanent damage to your lungs, then the statistics, the science says that after 7 years, the lungs can go back to being healthy and pink and clean. So you could have a black lung and then stop smoking, and after like 7 years you can return to having a healthy lung again. So they say. Okay. Now there's one thing that while I was lecturing, I realized I wanted to tell you. So I'm going to do that right now. Okay. So I was thinking about it, and I just didn't say it because I didn't have it on the slide. But when we were talking about the lesser omentum, we were saying the lesser omentum holds the stomach on the left side. Your stomach's on the left side and the liver's on the right. And that is true for almost everybody. But 1 out of 10,000 people has something called situs inversus. This is Latin. Situs inversus. And that is that all of their organs here, these organs are like reversed. And so the stomach would actually be on the right side and the liver would be on the left. And normally your appendix is on the right. If you had situs inversus, then your appendix would be on the left. So that can be pretty confusing with symptoms and things. And you wouldn't maybe not know you had it. So eventually, maybe one day you'll go and get like a sonogram or x-ray and it might be discovered, oh my goodness, your organs are backwards. You have situs inversus. If you have that, I believe you're supposed to wear like a bracelet or something like to let people know that you're backwards. All your organs are like flipped to the other side. At least it needs to be in your medical chart, so you're not like playing games and tricking doctors and they would be totally confused. So, but it does happen in like 1 out of 10,000 people. So I just wanted to make sure I mentioned that. Situs inversus. Okay, well that's it for today. Thank you so much.